Welcome to Real PT. Some of you may be wondering why I'm on the floor. Others may be wondering if I come here often. And this is my mother's living room, so the answer is yes, here very often. Today we are going to go over some hip exercises, specifically if you are post-op a total hip replacement. So that's the answer to question 1. So let's jump right in. You get into your creepy dad position, as so. Creepy dad is gender neutral, in case if you're wondering, so you can still be a mom and get into creepy dad position. It's totally cool. You want your ankles in alignment, knees in alignment, everything stacked well. The surgical side is stacked on top of the non-surgical. So the first exercise we're going to do here in creepy dad position is going to be a clam. So you're just going to push that knee up and down. Ankles stay together. Try and keep them stacked. If you're rotating your upper body, if your torso is rotating, you're cheating. Stop it. We want to isolate the gluteus medius muscle, which is one of your lateral hip structures. It's important for walking and maintaining balance while you walk. So in order to do that, it's going to be a little more of a limited motion. No twisting from the torso. It's all coming from the hip. We'll do 30 of these. And every exercise of these that I give you, try to do 30 of them. A lot of times people in therapy prescribe 3 sets of 10. 10 is great, that's fine. But the purpose of doing more is that your body feels it more. Oftentimes 10 is not enough. So we want to take that muscle from start to finish. We want to fatigue the muscle so that it builds endurance and that it builds structural durability as well. So now we'll straighten it. You do what's called an isometric, which is where you just hold the leg or hold any body part in a specific position. So you want to hold this, try to do 30 seconds. If 30 is too much, shoot for 10, relax. Do that 3 to 5 times. Next, hip abduction, kicking up. Rockette meets Little Mermaid. Again, try and do 30 of these. If you can't get to 30, do as many as you can before that lateral structure starts to fatigue. We also don't want pain. So while you're doing any of these exercises, you need to listen to your body. Discomfort is okay, that muscle burning sensation is okay, but we don't want pain. If you feel pain, you need to listen to what your body's telling you and stop. You know your body better than anyone else. So when it's giving you signs, pay attention to them. And then listen, do what it's telling you. Next, circles. This is going to work all of the structures of the hip. Anterior, lateral, posterior, medial. Do 10 one way, 10 the other way. It's going to be very difficult. Take a break after doing 10 each direction. And go again. Try and do 3 to 5 of these a day. Really strengthen that hip. Now, a lot of times when they do a total hip replacement, they still tend to cut in anteriorly. When they cut through anteriorly, they hit this hip flexor muscle here. So this muscle directly gets cut through. It receives the majority of the trauma from the hip surgery. So because of that, it's very important that we stretch it and strengthen it to enhance its rehabilitation, its rehabilitative function, and really restore it back to optimum tissue length and tissue durability. So because it is the main muscle cut through as well, we need to progress within reason. It's going to take time, and it may seem like it's taking a lot of time, but in the grand scheme of your life, it's just a segment, so you need to have patience and progress within reason. Again, listen to your body. So whenever you have a hip surgery, a total hip replacement, they give you hip precautions. One of those is to keep your hip at 90 degrees or below, to not flex above 90. If you are within the first 6 months since your surgery, listen to your hip precautions, know them, pay attention to them. This is very important. So again, if you are within the first 6 months of your total hip replacement, when you do this exercise, you're just going to go to that 90 degrees hip flexion and back down. Now, if you are post-op 6 months, meaning your surgery was more than 6 months ago, you will start at 90 degrees and bring it up. Nice, slow, and controlled. Work that hip flexion. It's important to get through both. The difference between the two, when you're coming just to 90, is that it predominantly works the quadriceps muscle. The hip flexor, the muscle that was cut through, the muscle we want to target, is activated secondarily to the quadriceps. So the quad receives the majority of the benefit from this motion. The hip flexor will get a little bit, but not as much as we want it to. So we have to, again, progress within reason. So after your 6 months, the first 6 months you'll be doing this. After your 6 months, you can really isolate that hip flexor, isolate that iliopsoas muscle, and bring it up. Nice, slow, and controlled. You might hear some popping, some cracking. That's okay. As long as there's no pain, no discomfort, you're not feeling it, the joint shift at all, you're fine. And at this point, you shouldn't. If you do, consult your physician. Talk to your doctor. Another exercise we'll do here, you're going to grab your handy dandy TheraBand. Now, to avoid violating those hip precautions we just talked about, you can have someone else help you with it. Start with the legs straight, sit up, put it under your ball of foot, come back down. You're going to bend the knee to 90, kick it back out. This is going to strengthen the posterior chain of muscles in the leg. It's going to help you ambulate up and down stairs more securely, walk more securely, provide balance to the hip structure. So you'll do 30 of these as well. Now when it comes to TheraBand, the grade changes according to the color. So yellow is lightest, black traditionally is hardest. It goes yellow, red, green, blue, black. You don't have to start at black. I do not recommend starting at black. In fact, start at yellow, and if it's too easy, work up to the grade that's more appropriate to your body. Listen to your body. No one's trying to, it's not a competition. You don't need to do the black TheraBand for everything right away or at all. You start where you're at. You have to meet your body where you're at and progress according to your own needs. Everyone's different. Now, to stretch the hip, we're going to flip over to the stomach and we're going to go into flat out Little Mermaid pose, or if you're a yogi, it's called Cobra. So your elbows are in line with your shoulder and you're just pushing yourself up. Your hips stay on the surface. You should feel stretch in the front of your hip. Again, there shouldn't be pain. We want stretch, and oftentimes with stretch is accompanied discomfort. That's fine. If you're feeling pain, if it's so hard you're holding your breath, then you need to back off. It's also important to keep breathing through these exercises. Don't hold your breath. Breathe. It's the one requirement, other than listening to your hip precautions. Now, if this is too easy, you can bend the knee. Get a good stretch. If it's still too easy, your hands come under your shoulders. Push yourself up a little higher. If that's easy, bend the knee again. Once again, listen to your body. If it feels like it's too much, it probably is. Back off. It's okay. So that was to stretch the front of the hip muscle, the anterior muscle. Now to strengthen the back of the hip, the posterior muscle, what we're going to do is elevate the leg. So keeping the leg straight and lifting it up. This is going to be very challenging post-op. You might not be able to lift the leg up as high. You might not be able to lift it up at all. If that's the case, just contract the muscle. Give it a good squeeze and relax. With the leg straight, you're targeting the hamstrings. To target the glute, you bend the knee. Bend the knee, do the same thing. Kick it up. If you can't kick it up, contract. Contract. And then eventually, bring it up. A way you could cheat is to get a pillow, put it under the front part of your thigh, and then it'll automatically elevate you. So you start in this position, contract, and then eventually lift it up again. So there is a well-rounded hip exercise routine for all of you mermaids that have undergone a total hip replacement. Again, it will help regain your creepy dad position, which is great for any family photos and whatnot. So pay attention to your body, move within reason. You know your body better than anyone else. Listen to it. Don't violate your hip precautions. and just push within reason. You don't have to do everything right away. It's okay. Your body just went through a lot. It's okay if you're not perfect once you just go through a crazy surgery. It's expected that you won't be perfect, and it's totally fine. So be patient with yourself. Move along accordingly. Don't rush things. That's it for another episode of Real PT. If you have any more questions, or if you want a free full consultation, which it takes into account nutrition, energy work, and physical work, movement therapy, such as physical therapy, feel free to reach out to us at edgarcaseyhealthconsults.com. You can leave a message, you can sign up for a free health consultation, and we can go from there.